lifestyle medicine is actually the therapeutic use of evidence-based medicine and lifestyle to treat and prevent illnesses. For example, things like diabetes, high blood pressure, stroke or heart disease.
So you mean lifestyle changes can be medicine? That's what you're saying?
Yes, you're absolutely right.
Hello and welcome to the Prologue to Wellness podcast. I'm your host, Cheryl, and today we're going to talk about lifestyle medicine. What can we as women do to safeguard our well-being and health? What screenings are essential? Which checkups should we go for? Today we will ask Dr. Odelia, who will share some tips with us. Hi, Dr. Odelia.
Hi Cheryl, thanks for having me here today. So I'm really happy to be here to share a bit more about what are the steps that women can take to empower their health. So I think you rightly pointed out we are very busy with our everyday life, and I think we all can identify the many struggles and the many challenges and the many hats that we have to wear.
So Dr. Odelia, first of all, what is lifestyle medicine?
So that's a very good question. I think for many of us, we have heard the term lifestyle intervention, eating well, exercising, but the word lifestyle medicine may be something that's a bit foreign to us. In fact, this is quite a relatively new concept in Singapore, at least in Asia, where we look at lifestyle as a tool or medicine to treat or prevent common illnesses. So for example, if I want to define it first, so lifestyle medicine is actually the therapeutic use of evidence-based medicine and lifestyle to treat and prevent illnesses. For example, things like diabetes, high blood pressure, stroke or heart disease.
So you mean lifestyle changes can be medicine? That's what you're saying?
Yes, you're absolutely right. In fact, the whole idea is that we want to address how we can live properly and live well to have better health.
So what is the concept of lifestyle medicine?
I think the word lifestyle itself conjures a lot of different imagery and different definitions to different people. So I think to simply put, you can actually define it in terms of its 6 pillars.
Okay.
So for example, number 1, you can look at nutrition. So that's something that we are very familiar with. So look at focusing on foods that are whole foods as well as plant-based food.
Okay.
Number 2, physical activity. So that's really important. So when you exercise, you move your body, you feel better. The happy hormones are released.
It's true.
But another way that you can look at exercise and physical activity is that we can look at this concept of sedentary time. So I like to define physical activities in 2 branches.
Okay.
1, exercise that we traditionally know as, for example, like jogging, running, swimming, etc. And also sedentary time, which is the time that you spend sitting down.
And that's considered
sedentary time. So you want to reduce that. So for example, you can walk more, you can like get one stop before your actual destination, to walk to your destination, and to clock in more steps and more mileage during your daily activities. Another thing in terms of one of the other pillars would be stress and sleep.
stress and
So
sleep.
as you know, when you are stressed or when you sleep poorly, you tend to fall sick more easily. All these are related to your hormones, to how you feel, your mood, and even affects how you make your decisions in terms of what you want to do with your time and how you eat.
Yeah.
So having restorative sleep as well as good stress management is also very important part in terms of lifestyle medicine, an approach to managing your health. Another 2 things that we can touch on. Number 1 would be avoidance of substances that might be risky to your health, for example, tobacco use or alcohol, excessive alcohol consumption. And finally, one point that is commonly overlooked is making good social connections. So when you are well integrated into your community, you know where to look for help when you feel down, when you feel like you need someone to talk to, and also when you're engaged in meaningful activities, when you are doing certain things with your friends, exercising together, all these also contribute to your general happiness and also your health.
Really the power of your own community that would...
Absolutely right,
Okay, that's nice. So lifestyle medicine is quite a holistic kind of approach towards understanding your body first and knowing what to do about it. So understanding your body involves really knowing what's going on in your body, right? And health screenings or health checkups. What are the differences, or what are the health screenings that one should kind of think about for themselves at different stages of their lives?
So that's a good question, because there are many different packages and a lot of information out there, and it can be very, very confusing for the general population. So I think number 1 is to take a step back and reevaluate where you are in terms of your life stage. So to put it simply, number 1, age is a good guide, gender, your own personal history, medical history, and also your family history. You can speak to your doctor, or you can search certain websites. For example, the Singapore government is very good in terms of ensuring everyone gets the basic coverage. And from then, you can read on to gain a bit more information and knowledge about health screening and what you should be looking out for. generally, in terms of preventive medicine, there are two big branches of it. One is health screening, and the other one is vaccinations. And within health screening itself, we break it down into screening for cardiometabolic issues like your BMI, obesity, high blood pressure, diabetes, as well as cholesterol, and also cancer screening. So if I want to come back to our topic about how women can take charge of their health, number one, I would ask them, where are you at your health journey now? How much do you know? And only from then you know how to move on from there. So I think to start first, you need to know what are the health screenings per your age, as per your age. Because different age group has its different concerns and different considerations to make. So I'd like to it'll be helpful in a way to broadly differentiate in terms of the younger age group, for example, the 20s to 30s, to maybe the middle age, about the 30s, 40s, and subsequently from the 50s onwards. And as a lady, there are different things that we want to look out for at each life stage.
Yes, correct. And because we go through different life stages and different milestone events, let's say if we break it down to a lady in her 20s, what should she look out for?
So the 20s is the best time to start your health journey.
Okay.
Prevention is always better than cure. If anything is picked up early, detected early, intervention can be made. And also there's this concept called primary prevention. So you want to intervene and to prevent problems from happening. So for a 20-year-old, usually I'll ask them to find out what is their current health status. Do they have any chronic medical conditions, or do they have any significant family history that warrants a more detailed earlier check? Usually for health screening for a 20-something, from 26 years old onwards, if you're sexually active, you should consider a PAP test. And then you can also consider looking at certain things like screening for your blood pressure, your cholesterol, as well as your diabetes. There are certain scales out there and questionnaires to see whether you're at higher risk of certain conditions, and that might suggest whether you need to start screening earlier. In fact, you can start this conversation when you're 18 years old.
Oh, wow.
Yeah,
okay,
so
yes.
you can screen for your blood pressure,
Right.
you can do a questionnaire to see whether you're at higher risk of things like diabetes or cholesterol, and screening can also be recommended at a point in time. Another interesting point is that vaccinations are part of preventive health. So from the time that you are born all the way to primary school and secondary school, etc., right, vaccinations is part of our healthcare system. So in the last few years, they've introduced HPV vaccinations, I think from secondary one onwards. So that's another good move by the government to introduce proactive health interventions early on.
Okay. So in your 20s is the best time. It's where you can really focus on preventive health.
Yes,
Right.
and to maybe elaborate a bit more, HPV or cervical cancer vaccination is good to get it before it's actually active.
Before?
Yeah, before,
Okay.
yes.
Okay.
So that's an interesting concept because when you're young in particular, you're not too aware of what certain things that you might be looking out for. So the whole idea of getting it when you're younger is that is before you're exposed to that particular virus that can cause cervical cancer.
I see. Okay. Okay, then what about when you progress to your 30s then?
So when you're in the 30s, I think our challenges and also our goals in life are different. So that's the time that we want to reevaluate in terms of your health status, whether there are certain cardiovascular risk factors that we need to look into, and also continue on screening for your cervical cancer. Another thing at this point in time will be, I think a lot of women are considering fertility issues or any postpartum issues as well. So for example, if you're looking into fertility, there are a few simple steps that you can take to ensure that you're in good health and to also increase your chances of conception. So maintaining a healthy BMI, ensuring all your medical conditions are under check, that's a good way. And also for postpartum issues, it's also important to look whether there are any issues that were highlighted during the pregnancy that requires follow-up. So one common condition is gestational diabetes. So that's something that is increasingly picked up during the pregnancy period. And that itself is a risk factor for developing diabetes later on.
Okay.
So even though most of the time you do revert back to your normal glycemic or sugar control state, that requires you to still screen regularly to see whether there's any diabetes. Because for conditions like diabetes, you don't get any symptoms most of the time, unless it's much later.
Okay. What about then in your 40s and beyond, right? It doesn't just stop there after giving birth. We go through another cycle,
Yes.
which is
Yes.
perimenopause and menopause.
Absolutely.
What do we do then?
So I think for ladies, the challenge is there's so many things going on in our bodies, the different hormonal changes, and the different things that we encounter in life. So when you're 40, one important step that you can start taking is to screen for for breast cancer. So when you're 40 and above, you can have a discussion with doctors whether you should start screening via a mammogram. So if the discussion is that, yes, I think we should proceed with that, then an annual mammogram would be helpful. For those of 50 and above, right, then a screening mammogram once every 2 years would be helpful. An interesting thing in terms of cervical cancer, in particular for ladies, is that after you're 30, the type of cervical cancer screening is different. So traditionally, if you're less than 30, you're doing a PAP test. So that looks for the cells or abnormal cells around the cervix. Whereas when you're 30 and above, we usually screen with the human papillomavirus test. And that screens for the virus that predisposes you to develop cervical cancer.
Right, so you should do one in your 20s and then again.
So that's a very good question. It's the timing of when you do it.
Okay.
So for example, once you turn 26 and you're sexually active, you should start your cervical cancer screening. And at that age, it's usually a PAP test.
Okay.
And when you turn 30, you screen it with HPV DNA testing.
Right, okay.
The frequency is, if you are doing the PAP test, you screen once every 3 years.
Right, okay.
And for the HPV DNA, because it's very accurate, you screen once every 5 years if your previous test was normal.
Okay, got it. Oh, that is a new thing and that I have not heard much about. Thanks for sharing. Dr. Odelia, just going back to the 40s, besides the mammogram, what else should a lady look out for?
Okay, that's a good question. So I think when you're hitting your 40s and the 50s, you'll start noticing there are certain changes to your body, and you might have certain questions that you may not think about it when you were earlier on or younger. So number one, I think it's important that you want to screen for colorectal cancer or colon cancer, and that should start from 50 years old if you have no family history. Of course, if you have certain issues before that in your family, then the recommendations to start screening will be earlier on. So there are a few ways that you can go about doing it. So when you're 50, you can do a stool or cup test. So that's done yearly, and that's to detect for any blood that cannot be seen in the stools, but is already present. And the other way is to do a colonoscopy. So that one, if it's clear and okay, you can actually screen once every 5 to 10 years. Additionally, at this point in time, it's also a good chance to start talking about menopause, perimenopausal symptoms, as well as bone health. So bone health and osteoporosis is something that we do see in a lot of the older female patients, especially when they go for screening. And that also comes from the fact that vitamin D deficiency and certain mineral deficiencies that might occur when you're earlier on. So when you are around this age, you may start experiencing certain symptoms that you might be wondering whether it could be menopause or not. So number one, what is menopause?
Exactly.
So menopause is actually a retrospective diagnosis. So basically when you look back and you do not have any menses for the last 1 year, then that defines as menopause. However, in the perimenopausal a phase or period, that can precede this by a few years. And during this time, you can start having symptoms already. So commonly, you can notice that there's certain sleep disturbances, mood changes, hot flushes. All these are very commonly experienced by female patients. In Singapore, the average age is about 45 to 50. Average is about 49 years old. 49 for females in Singapore, which is a few years younger than menopause age in the other Caucasian populations.
Okay.
So at that point in time, I think it's important for women to realize that what they're going through is normal, and there are ways that they can then go about doing it to improve the symptoms. And a lot of times, these symptoms can improve with time. So commonly, for example, if you look at hot flushes, so for a lot of these ladies, they may feel embarrassed that they may be going through these periods of times when they're perspiring a lot or uncomfortable. You can have a chat with your doctor first, because for example, you can screen for certain conditions like thyroid conditions to make sure that you're not missing out any other conditions that can warrant intervention before you can look into other ways to try and manage it. So for example, very simple ways can actually make a huge difference. And a way that comes back to the whole idea of how your lifestyle can treat your symptoms and help your symptoms. So simple interventions by taking a cool shower before you go to sleep, dress in cooling, comfortable clothes, or sleeping in a well-ventilated room, that also can help with it. And also knowing that there's an end in sight for most ladies, right? Also helpful in terms of understanding what they are to expect in their journey in general. In terms of screening for menopause, screening tests are generally not really needed or necessary, but it can be considered. We can also consider other screening for bone density. So it can be simply done by bone mineral density scan, and it can be considered if you are experiencing menopause or if you have family history of osteoporosis. Yeah, that can screen. Then you can screen for menopause, for menopausal symptoms, as well as your bone mineral density earlier on.
So for a lady that's experiencing these menopausal or perimenopausal symptoms, such as your night sweats and so on and so forth, are there anything they can do from a lifestyle medicine perspective to manage these symptoms?
So number one, it's very important that your overall health is good and you are well supported, you're healthy and you're happy. So making good social connections, ensuring that you are well plugged in a community will actually play a very huge role in terms of your overall health and mental well-being. So number one, if you are able to connect with a support group or your friends, even your friends, if you start the conversation, you might realize actually everyone's also going through the same thing. And it's helpful when your friends are going through the same things. You can share tips, and sometimes just hearing each other out is helpful as well. So it's important to get yourself into a good community. And also lifestyle medicine is lifestyle medicine for a reason. Lifestyle means your everyday activities. We want something that has become your daily routine, your habit, and with that, the benefits as well as the ability to carry out on a long-term basis is helpful. Because number one, simply when you get out of the house, when you exercise, you walk, or you eat properly, you eat well, you feel better. And also that helps prevent other chronic conditions that are also tied up very closely with diet and exercise. For example, things like hypertension, diabetes, cholesterol, all are linked to your lifestyle intervention. And those can help prevent these conditions that are more prevalent at the older age.
Thank you so much for sharing, Dr. Odelia. I think this whole perspective of lifestyle medicine is very refreshing, more preventive care rather than really going to see a doctor when you have a problem. There's actually another topic that I think is very often unspoken, kind of taboo. People don't like to talk about it, and that is also like sexual health. With, say, the risk of sexual diseases, what are some of like the preventions or precautions that one can take?
So that is a very good question. I think in our Singapore population, that's something that's not often spoken about. And also I think for patients coming from their point of view, it's not easy even to discuss with a medical professional. So I think awareness, number one, awareness and ensuring people are educated that it's okay to talk about it, and it's okay and important rather to seek medical attention earlier is very important. So in terms of female issues, so I think I also want to bring in other things that may not be sexually related. For example, common women issues like urinary tract infections, vaginal discharge.
Correct.
Those are topics that happen to women, but it's a bit difficult to talk about it. So in fact, number one, a urinary tract infection is not an STI. And if you're looking at vaginal discharge, there are many causes for it. Sometimes it's just due to hormone reflux, it can be normal. Sometimes it's due to non-sexually transmitted conditions like candida, or sometimes it also can be due to sexually transmitted conditions. So I think we need to normalize talking about it, and it's important that people know that they are going to a trusted provider, healthcare provider, that their needs can be addressed adequately.
So we have non-STIs that you've mentioned, Dr. Odelia, which is your UTIs as well as vaginal discharge, right? So I think UTIs happen quite often for ladies. Is it common? I mean, some people are so shy to talk about it and they suffer in silence. What would you like to say to like ladies out there who might be suffering in silence?
So number one, UTIs are quite common in ladies. It's basically due to the fact of how our anatomy is. Our urinary tract is shorter and structured differently from males. So women can get urinary tract infections. What they should actually look out for is how to prevent it, and also when you do have, what are the symptoms to look out for. So if you do have any of these symptoms, to seek treatment earlier on before complications arise. So number one, because we are down the line of preventive care, how to prevent that from happening. So number one, drink lots and lots of water, hydrate yourself well, and go to the toilet regularly to relieve yourself. So that's very important because that dilutes and it reduces the chance of bacterial accumulation and formation. Number two also is to make sure that you are good hygiene. So for example, so you wipe from the front to the back, so you reduce introduction of bacteria to it. And another thing to look out for is look out for your immune system. So you find that you're having recurring UTIs, it might be a good idea to screen for things like diabetes, because things that would decrease your immunity can also predispose you to getting recurrent infections.
Right, okay. So to summarize, for people with UTI, stay hydrated.
Don't hold your urine.
Don't hold your
yes.
pee.
And good hygiene.
Good hygiene,
and get
also
your screening.
get your screening,
Yeah.
and also wipe from the front to the back. Okay, I
Yes,
think those
correct,
are
yeah.
very useful tips for us. Okay, and how about vaginal discharge? Like sometimes for ladies, we see some change also in the discharge. Sometimes the color, the smell. What should we look out for?
So number one is important to understand your body. So our vaginal discharge will change with our menstrual cycles because of differences in our hormones. So number one, maybe you just make a record of what is normal for you. And we find that there's certain deviations from it, right? Then that's a chance that you do need to maybe go for a further evaluation. Common causes, common symptoms that you might want to look out for is when it becomes itchy, painful, the color or the smell is different, it becomes very thick, curdy, or you find that there's abnormal bleeding in between your menses or after intercourse. So those are definitely signs that you need to watch out for and get some medical attention.
Okay.
So I think back to the question of what are the causes for it. Yes, it can be normal. It can be related to non-STI, sexually transmitted conditions, and it also can be related to sexually transmitted conditions as well. I think important is to understand your body, to know what is normal, to watch out for red flags or symptoms that may signal you to warrant an earlier review with a doctor, and also be aware of this thing called screening. So there are certain ways that you can do regular screenings for sexually transmitted conditions, which can be done via maybe, for example, urine test or swab. So those tests can be done even before you have your symptoms.
Right,
Yeah,
okay.
so treatment can be started earlier.
Okay. How do you then know when to see a doctor? Let's say if you see or observe some symptoms that are different, to check for a sexually transmitted disease.
So if there's any deviation from how your baseline discharge is, or you find that there's increased itchiness, pain, abnormal bleeding, or changes in the type of discharge, for example, it becomes thick, curdy, greenish, the smell is different, for example, like a fishy smell, those can be indications that you may need to seek medical attention earlier.
Okay, got it. The first thing that we want to think about sometimes is just making that first step.
Absolutely.
What would be your tips, Dr. Odelia, for someone who wants to embrace this whole idea of lifestyle medicine?
So number one, if you're thinking about it already, that is a very good step
Yes.
already. And I think in line with perhaps our clinic name, Prologue,
Yes.
health is a journey.
Correct.
And there's always a starting point, and the starting point takes a lot of courage to even embark on this journey. So I think number one, for any busy female or women in general, is to take a pause,
Yes.
create some time for yourself, give yourself grace, and understand that when you feel better, you're happy, and also you can allow those around you to feel happy too.
That's very nice.
Yeah, so I think number two is that take time to read up, to speak to your trusted healthcare provider to make sure you're getting the correct information. Because we also don't want to go on the other end where things are not sustainable, where it creates more anxiety rather than help. Because being healthy and happy, you need to be able to filter out information that's not helpful.
Yeah.
Yeah. And number three, just try lah. It's okay. It's okay. You're experienced to trying.
Yes.
And you'll always learn something to trying.
Yes.
So when you take the first step, you find out a bit more information about what's going on, take the next step to try. Don't be afraid of the results, because we're on a journey and we're all learning together.
Thanks, Dr. Odelia, for sharing. That's really very beautiful and very encouraging. That's all we have today for the Prologue to Wellness podcast. At Prologue, we believe that healthcare deserves a new narrative. Till then, take care and be well.